Well, good afternoon, and welcome to the Ask Me About Nurse Clinics, a guide to establishing a successful nurse clinic webinar. This is brought to you today by Riwka Hagen and APNA, the Australian Primary Healthcare Nurses Association. Riwka is a certified practice manager with over 20 years' experience in healthcare. She's the founder of Medical Business Services and the Practice Managers Network. Riwka provides professional consultancy services to primary healthcare organisations, and she has successfully supported nurses across Australia in setting up multiple nurse clinics. APNA are the peak professional body for nurses working in primary healthcare across Australia. We advocate for primary healthcare nurses by giving them a voice, and we also offer access to quality continuing professional development, educational resources, support, and networking opportunities. My name is Sarah Sewell, and I'm a project manager at APNA, and I lead the Building Nurse Capacity project, which supports nurses to develop their own nurse-delivered clinics. I'll be facilitating this webinar with my colleague Margaret Dempsey, who is a project officer at APNA. We are both nurses by background. I previously worked in mental health services for 10 years in the UK, and Margaret has worked in general practice for 10 years here in Australia. Our learning objectives for today are to learn the steps to develop a nurse clinic, gain an understanding of how to budget for a clinic, and establish how to implement and evaluate a nurse clinic. So I'll now pass you over to Margaret, who will talk to you about what a nurse clinic is.
Thank you very much, Sarah. Welcome, everybody. What do you think about when you hear the term nurse clinic? A lot of people still think that nurses running a nurse clinic are doing it autonomously, totally on their own. And really the definition of a nurse clinic is a nurse-delivered, team-based model of care. So involving the team and your practice team is really crucial to the success of establishing and implementing a nurse clinic. So successful clinics do utilise a team approach, and that involves clinical and non-clinical staff. So just remember, when you're establishing a nurse clinic, it's the practice setting up the nurse clinic, not just the nurse. The nurse is, of course, the champion and the key driver, but you really need support behind you. And if I give a sort of an easy analogy regarding that, is thinking about building a house. You know, you've got all different trades working together to complete that project and build the house, but every individual has a role to play. So if the plumber does all the work, you'll have a lovely network of pipes, but your roof will cave in. So you really need that whole team approach. And just using that analogy again, it's no point having the concrete or laying all the foundation and doing a lovely job if there's no openings for the pipes. So just remember that a nurse clinic is a nurse-delivered, team-based model of care, and the key theme is involve the team in what you do. Thanks, Sarah.
Okay, so we've talked about what a nurse clinic is, so why should we set one up? Well, nurse clinics are generally more proactive in the delivery of care. So this means taking control and making things happen, and also often anticipating and preventing health risks before they arise. Other benefits include improved patient outcomes. So nurse clinics generally have a more holistic approach to care, as nurses will not only assess and treat the problem that the patient is presenting with, but also look at the patient as a whole, incorporating biopsychosocial factors and promoting self-management and self-care. Patients subsequently feel more listened to, they engage more, and they have increased satisfaction in their care, which all lead to better patient outcomes. Evidence has also shown that patients also report improvements in their general health, quality of life, and tend to engage more in healthier lifestyles. Another benefit is nurses having increased autonomy. Nurse-delivered clinics can enhance the nurse's role and be an empowering experience. Nurses can increase their knowledge and skills as a result of running a clinic, and in turn increase their confidence and job satisfaction. Nurse-delivered clinics are a really effective way to involve patients in their own healthcare by providing a more integrated and patient-centred approach. So by spending time with individual patients, nurses are able to develop valuable insights into patients' lives and their lifestyles, which means they can provide more tailored care and support. They're able to offer patients health education, and ensure that they have a good understanding of their conditions or needs so that they can play an active role in their own healthcare and treatment. And by having that additional time, nurses are also able to develop more longer-term relationships with patients and build trust and rapport. So as I've mentioned, nurse clinics have shown to improve patient outcomes. They also provide more timely access to care and also can decrease the rates of hospital admissions. And in rural and remote areas, with patients having limited access to healthcare services, nurse-delivered clinics can offer patients vital access to health, advice, and treatment. Nurse clinics are especially effective when patients need to play an active and ongoing role in their healthcare and treatment, for example, to manage conditions such as diabetes, when patient education and understanding is needed, such as in sexual health clinics, when closer long-term relationships between patients and caregivers is required, for example, when working with older patients, and also when establishing trust is vital to care. This could be when you're supporting people with their mental health. Now, from my experience through the APNA Nurse Clinic project, we've also found a number of benefits. Nurses were able to provide services to patients in their local community, which was not previously accessible, and patients would have had to travel further or access acute services to receive that treatment. Patients have also been diagnosed earlier, treated quicker, and provided with follow-up care in their local practice. And services have also established more effective team working. So now we've talked about what a nurse clinic is and what the benefits of them are, I'll hand you over to Riwka, who will talk to you about the steps to setting up your own nurse clinic.
Well, hi everyone. It's really lovely to be with you all. We've had a stellar lot of registrations for today's webinar, which is just wonderful, and I always really enjoy speaking both with nurses and with practice managers about the systems that you need to put in place in order to get an effective nurse clinic up and running. And I guess, look, the reason why sometimes these can be a little bit tricky to set up is because there is no one size fits all, and the opportunities for the type of clinic that you can implement are very different for different practices. So it really asks of you to really carefully consider what your circumstance is for your practice, for your patient population, and then look at the systems and the resources you've got available in order to develop an effective service. So there are a lot of bits of information that will go into determining what sort of nurse-led service you're able to put together, how you're going to budget for it, and how you're going to run it. So the first dot point here is with regard to mind mapping, and this is just really a little tool and a system of thinking that helps you to bring your team on board and do some of that ideation. So thinking about what your opportunities are, troubleshooting and developing solutions to help you to implement your clinic successfully. So I'll show you in a moment what that mind map might look like for your nurse clinic, and you can just use some of those ideas to take forward to your team. So we'll be looking at exploring some different models of care, and also we'll be talking about the consideration of different fee services. So some practices are fully bulk billing services, other practices will have private services as well. You may have some ideas for services that you would like to deliver for which there isn't a Medicare rebate. And I guess one of the messages out of today's session too is to not shy away from novel and innovative ideas if your idea matches a need that your patient population can really display. So I want you to kind of throw away the shackles of the way you've always done what you've always done, and consider what a new framework might look like. At the moment, in the space of coronavirus, that's particularly relevant because, of course, we have to run our businesses very, very differently. So we also know that practices are quite constrained in terms of seeing lower patient attendances, and therefore just the concern of how, for example, patients with chronic illness are being supported, and how we can ensure that our patients are able to receive appropriate and timely care when perhaps face-to-face services are becoming more and more difficult. So there are some ideas that you can put into place to consider how you can really respond to some of those challenges. And perhaps thinking about really developing your nurse-led services could be a really great way, not just to protect the livelihood and the service delivery for nurses, but to ramp up the quality of care that you're able to provide as well. So there's lots of ticks in that, but it will require you, as Margaret and Sarah indicated just before, to bring the team together, because there are some thinking bits that are going to require different team members to have their input so that the service is going to run successfully and have that longevity around it. So let's kick off. Let's have a look at this mind map template. This looks pretty rudimentary. It's a fairly simple plan, and it just kind of gives you the outline of the key thinking points that you'll want to keep in mind when you are starting to develop your service. This template is actually available from the APNA website. So again, no need to be taking pictures or anything like that. You'll have access to all of these resources to help you when you start putting on your thinking cap. So here are some of those sort of key broad topic areas. You need to start with a clear plan, and that's what I was alluding to just before as well, that your planning is really key to ensuring the success of the service. So your planning would consider things like, well, what is the service that we're actually going to run? Are you going to be focusing on a specific disease entity? Are you going to tap into some specific skill set that your nurse has or your nurses have that you would like to develop further? And an example of that might be a cervical screening clinic, or as Margaret indicated before too, a diabetes clinic to support care planning and health assessments and the like. So you need to just have that planning in place. In terms of the planning too, and some of these other dot points really do speak of that as well, is, well, what's your facilities like? So your location and your facilities, what space do you need in order to run your service? Do you need just a telephone at the moment, or some telehealth facilities? Or do you need a dedicated nurse consulting room in order to be able to do physical examinations or have private interviewing time? What have you got available, and what modifications might you need to make in order to make the space that you do have suitable for the purpose of nurse-led services? So it's looking at the bricks and mortar of your practice and determining what needs to change or what's already ready to go. You might also find that at this sort of location or facilities level that you identify some major barriers, and that's a common problem for practices as well, where actually having the room availability is one of the big barriers in being able to further explore your service delivery. So then it might be looking at sharing some space. Is there a consulting room that perhaps isn't used for an afternoon a week? Or are there specific hours that you can maximize your room utilization? So again, I'm just kind of doing this free floating thinking in terms of the location and the facilities and how you might be able to respond to it. And that's the kind of thinking that you need to apply for your own circumstance, for your own practice. You've got to have a think about your staffing and human resources. So what people do you have available on the ground? And obviously that also includes GPs to support the work that you're going to be doing, but also your nurses. What is the time capacity that they've got to undertake activities that are different to what they are undertaking now? And not just nursing staff, but also administrative staff support. So for a lot of the nurse-led service development, there is a fair bit of administrative support that's going to be required in order for the service to run effectively. And by that, I mean examples such as running reminders and recalls, making sure that patients are booked in at the right time with the right nurse, with perhaps a duplicate appointment for the GP to come in and verify the service. So there is a lot of coordination and administrative work that stems out of some types of nurse-led services as well. So you've got to consider what you need, and then obviously what kind of expertise is required to ensure that everybody understands what their role is in developing this particular service. Another key component is going to be around patient engagement. Just because you've got some fabulous ideas for a new service doesn't mean that your patients will necessarily be on board with that. So you may need to think about how you're going to market your service, how your patients going to be aware that you are developing some new services, and how you're going to encourage them to tap into that and participate. And that's a big piece of work. So it might be around developing some posters, social media campaign. We'll talk a little bit more about the sorts of activities that you can undertake a bit later on in today's session, but engaging patients is going to be a key component. Another great way of involving your patients is to actually ask them what the service might look like from their perspective and what they would like to see. So think about engaging your patients even at the outset when you are planning your services. Ask them, ask your patient cohort that fits the profile of your idea, whether what you've got in mind actually meets their needs. And you'd be surprised at some fabulous ideas that they can come up with to help to develop the service in a way that's going to be meaningful to patients. So again, when we're considering patient-centered care, planning from the outset with patients in mind means that you do need to tap them on the shoulder and ask them what they think about the service that you are planning or that you're just starting to roll out. Now, another key component of the planning and thinking is around the funding for the model. And this is absolutely crucial. Now, we know that, that practices are mostly funded through the Medicare benefit schedule, through item number charging, through Medicare. I'm going to be talking to you about a pretty nifty tool that's going to help you get a much better grasp of what the financial picture is going to look like for the service that you are planning. This can help you to build a business case and convince your bosses, your practice owners, that your new service has got legs and is going to be successful, or it will allow you to, again, look at modifying whatever it is that you've got in mind to ensure that that financial viability piece is really ticked off as well. So don't panic about that. I'm going to talk you through that in a bit more detail as well a bit down the track. So then we are looking at really implementing systems and processes to support the service. We will be looking at involving best practice guidelines to inform how we deliver what we deliver. So using tools and resources and methodologies that are scientifically validated and approved. So ticking that off and ensuring that you do have robust systems and effective processes in place is going to be a key component of this work as well. Then as you start to implement your service and working out whether it's all kind of going okay or whether it needs some further tweaking, that's going to be pretty natural that you're going to develop your systems as you go. You need to start looking at formal evaluation too, formal or informal evaluation. And so that's really asking feedback from the entire team, including your patients, about what's working well and where can improvements be seen as well. So that gives you sort of that big picture, bird's eye view outline of the key areas that you need to look at. And I can see Sarah's popped her camera on and she's got a question for me.
We have had a question, and it's just regarding getting some feedback and understanding about the population. So is it worth doing a survey of the community in regards to what they need?
Well, good that you've asked that, because as we come through to the next slide, which is all around gathering data, definitely you could ask your patient cohort. But I would say chances are you've already got a huge amount of data within your practice, and it's housed within your practice management software. So it's where you record all of the clinical information for your patients. It absolutely has a wealth of data that can help to inform you about what services you could be developing, you should be developing, and where those opportunities really are. So when we consider data, the sorts of tools also that are really useful in helping you to get a big grasp of where the opportunities are extraction tools. So that could be, for example, PenCat, or for practices that use Polar. These systems are secondary pieces of software that sit alongside your usual practice management software like Medical Director or Best Practice. And it helps to make sense of all of the bits of data that are in your system and that can be really difficult to kind of tap into. So these extraction tools, most practices already have them available, and I would really encourage you to work with your practice managers to start looking at some of that data and highlighting the areas for opportunities. So you may also know that through newer programs like the QI Practice Incentives Program, the QI PIP program, where practices are actually being asked to extract and look at the 10 sort of key national health data set items of highest priority. They could be great starting points for actually getting your nurse-led service up and running. So these data sets are looking at things like diabetes, immunization, lifestyle factors, etc. So there's 10 key criteria, and even by simply looking at that data set, it might show you that you have an unmet need of care for perhaps your diabetic patients. So that could be your prompter to say, well, what can we do to improve and systemize the care that we provide to our diabetic patients, so that perhaps we see an improvement in metrics like hemoglobin A1Cs, and other metrics. It might be about weight control. It might be about lifestyle factors. It might be around, activity, diet, all these things that are important for those disease modalities. But when you look at the data coming out of those systems too, you may actually find that there are a number of other opportunities. And I would really encourage, especially practices that are already providing some services as far as nurse-led opportunities are concerned, to start to expand their thinking and tap into I guess, condition areas that perhaps are a little bit more left of field. I'm really happy to let you know that I'm currently working with the Heart Foundation on developing resources for improving, for example, the heart health check. So that's a new item number. It's a health assessment that has been around for a little while, but it's not gaining a lot of traction. So the Heart Foundation is saying, let's make some resources to make it easier for practices to undertake more of these heart health assessments. And when I look at that, I think, what a great opportunity for nurses to take a leading role in, quite a bespoke type of service. Another committee that I'm heavily involved in is around the improved diagnosis of hepatitis C in practices. So again, this is a condition that flies a little bit outside of what we traditionally perhaps think of for most practices. Perhaps for some practices, this is very topical and part of sort of normal business, but for others it isn't. So again, it's about just thinking, is there an opportunity? Do we have a patient cohort, where we are missing important information, or we are even missing diagnoses altogether? So again, look, I guess I could talk all day about the types of conditions that you could be targeting. But my message to you is to look at your own data and identify where those opportunities might be. So when you're gathering data too, and you're starting to formulate some thoughts around the sorts of services that you might want to develop, having an eye on any risks associated with developing the service is really important to remember as well. So it might be around, the credentialing of your staff, so making sure everybody remains working within their scope of practice always, of course. But any other risks that might be inherent in the service that you're looking to develop. In terms of team acceptability, I guess what we're really talking about there is ensuring that you've actually had broad conversations with your practice team about your plans and how you're going to roll them forward. So in order to get really good success out of these programs, every team member needs to really understand well what their role is in this particular service development. And by involving them right from the start and allowing them to have a voice in terms of how certain processes might run or what systems might need to be in place, you're going to get far better team acceptability for the program that you're seeking to implement. And that will then start to answer some of those questions in terms of how your service is going to run. So in terms of developing the model too, as I hinted at before, you need to think about how patients are going to tap into that service, how they're going to be made aware of that. Do you require other referrers to, tap patients on the shoulder and say, look, we've got a new service and you might want to tap into that? And mostly that will centre around GPs within your practices being really aware that you've got some new services that you would like to roll out, and therefore opportunistically identify patients. And of course, nurses have a really integral role in this space as well. So they can identify patients as they're coming through, perhaps for other services, and say, look, we've got some newer services, and would this be of value to you? So you can imagine too that you need to have information available for your patients at the time where you've got them as a captive audience, to see how you can best maximize the opportunity for engaging them into the service. We've talked about the facilities, and we've certainly talked a little bit about the staffing needs. In terms of the timing, you need to think in terms of how long before you start rolling out your service, how much time do you require to actually deliver the service, and what does that sequencing kind of look like? So again, I'm not giving you anything specific, because it's going to look very different depending on what sort of service you're looking to develop. And as far as team buying is concerned, I've had a chat about that as well. So in terms of building a budget plan, and I hinted at this just before, that this is going to be such a key component of success of the service, and the ability for the practice to actually support that going forward. So this is the Nurse Clinic budget tool that I've had the absolute pleasure of developing with APNA for APNA, and it's been in place for quite a long period of time, and it just gets updated periodically as new changes come about. So this resource is available for you free of charge from the APNA website. And this tool also has a very detailed explainer to go along with it. So if I'm kind of skipping through this reasonably fast, don't panic, because there's a lot more information about this available on the APNA website. So in essence, what this tool will allow you to do is to look at all of the revenue or income components that your new service is going to achieve. And it's then also going to look at what are the expenses that are going to be associated with that service. And so on the left-hand side here of this particular tool, you'll see the income calculator is in the blue section over here. The expenses calculator is over on the right-hand side here. I'm just going to blow this up a little bigger so that you can get a closer look at the fields. So you'll see here a whole stack of MBS, so Medicare item numbers. These are common item numbers used to support nurse-led services. And it gives you a very quick sort of summary of what each of those item numbers are. I would really encourage you, if you're not terribly familiar with these item numbers, that as part of your learning, you go into the MBS online system. You can type in all of these item numbers and you'll get far more information about what each of these items actually requires. There's a lot of blurb around all of that, so it's important that you understand that. And certainly you know, for the nurses here too, very worthwhile to really have a good grasp of this. And you'll see that there is a sort of a caveat there to ensure that when you use this tool and when you're rolling out your services, that you remain compliant to the Medicare benefits schedule always, because that is one of the big key risk areas too, that if you get that wrong, you know, your practice may be asked to repay all of the funding that it's received through that system. That's not a good way to go, and we certainly wouldn't want to see that happening. So the way this works is for each item number, it provides the Medicare rebates, which are currently up to date. And what you are going to be looking at is developing what a session looks like for your practice. So a session could be one patient, or a session could be a couple of patients. A session could be a couple of hours. It could be half a day, it could be a full day. So how you determine a session or a work plan is entirely flexible in the use of this particular tool. So when we talk about number of patients per session, remember that that notion of a session is defined by you, not by the system here. So this dummy example here indicates that for this particular session, the practice is going to utilize 2 GP management plans, a couple of team care arrangements, a few reviews for both the GPMP and the team care arrangement. It's also going to involve a health assessment and perhaps a couple of heart health checks. So you can see that's, you know, that's a fairly robust service, and you can see that you know, possibly speaks to you know, someone like a diabetic type of person, but that's not defined in this particular budget planner. So what you'll then see is that we've given some guidelines of how long a nurse may need to spend in actually completing some of those items. And it then simply multiplies it out. So for example, along the first line here, for 2 GP management plans, ostensibly for 45 minutes, for 2 patients, that means it's a 90-minute service that you're going to be planning on. Now, you might say, this is just the example to kind of get you going, but you can allocate a different time to the time suggested in the outline here. So in this example here, we've upped the amount of time for the nurse from 45 to 60 minutes. So that makes it 120 minutes. But instead of allocating 15 minutes for a team care arrangement, we've allocated no time for that at all. So you can see that there is a great deal of flexibility in the way that you allocate the timing and the activities of your nurse service. And it will then multiply out the number of services by the Medicare rebate to show you what your income is likely to be from a Medicare rebate point of view for those kinds of services. So that's probably all I want to say about the revenue side as far as the Medicare item numbers are concerned there. But you can see that there is a lot of option and a lot of choice in that. And Margaret's come into the conversation, so I'm guessing there is another question there. I don't have visibility on the questions, so shoot, Margaret.
That's all right. Hello, Riwka. There's a few questions that relate to MBS numbers, so I just thought this was a good time to perhaps mention them.
Yes.
So someone's asking about, are the MBS item numbers for nurses in a privately run nurse clinic, or does the nurse have to be employed by a GP practice in order to have a nurse clinic where they can use item numbers?
Oh gosh.
And I'll just keep going, because the next one has a similar vein. Can you still charge under MBS items if an independent practitioner, but patients are referred by GPs? And another one is, as nurse practitioners, can you claim MBS items of the 4 times specific telehealth items? So basically they're wanting to know, how can nurses utilise MBS, or can they utilise MBS independent of GPs, really?
Okay, look, the short answer to that is no. Nurses can't use these MBS items independently, with the exception of a nurse service 10997 or an Aboriginal Torres Strait Islander service, item number 10987. So unfortunately, Medicare has taken away a lot of the nursing items that were previously, and by previously I mean quite a long time ago. There were things like wound care items and immunisation items, where there was a Medicare item that was claimable for work done by a nurse. But that's now been really restricted down to just those 2 nursing service items. Now, what is important to remember is that nurses may participate in the collection of information for the purposes of the GP management plan. So, for example, for item number 721, it is still an item number that is claimed by the GP, but the nurse is permitted to provide assistance with gathering the information for that service. So when I start talking about calculating your expenditure, this is where it's going to become relevant, because the way that a practice deals with those items that is billed under a GP's item number, there is flexibility around that, and you can certainly have some innovation around that to ensure that the fee flows in and out are balanced so that your nurses are adequately recognised for the input that they provide. Now, nurses can also, you can certainly charge a private fee for a non-related service. That's certainly possible. You would need to think about the acceptability to your patient cohort. And I'm certainly not, discouraging you from considering that at all. I think, nurses have a lot of value, and I've certainly worked in the space of nurses having developed services which are totally privately funded. So it's an out-of-pocket cost. There is no Medicare rebate associated with it. Many practices kind of go, oh, we can't do that. But it's simply a mindset that needs to be changed to recognise the value of nurses too. So, there's certainly a possibility of doing that. Now, I will say that there are strict Medicare criteria around bulk billing and charging fees on top of that. So essentially, Medicare does not permit any item to have a gap fee charged if that item is being bulk billed. What practices can do, again, it is a workaround. If your practice decides that you cannot provide these kinds of services at the bulk bill rate and have the nurse adequately remunerated, etc., there is nothing to stop a practice from developing a private fee schedule that also includes these Medicare item numbers to be rebated, and the private fee simply reflects the value of the service that you're going to be providing, and the patient simply claims the Medicare rebate back. So it starts to get really quite convoluted, and it probably is a conversation for for another time to really deep dive into the Medicare benefit schedule and the many rules and regulations that sit around that. So there is complexity in that, and you do need to be really mindful of that. But if we just come back to this tool and how this can help you, what you can see here is there is a section here, and it might be a little bit tricky to see on the screen here because it's quite bright. So all of the areas that are sort of highlighted in a very pale blue are the items where you can put your own items in. So you'll see here there is a section for adding a practice own items. So for example, if you're really developing some services that just don't fit any of those Medicare item numbers, you can determine what that's going to be, how long it's going to take, and what fee you're going to raise for that. So the template simply allows you to incorporate that. So that then means that when you've calculated what you're going to do and what your revenue is going to look like for each item, it's going to tally that up automatically for you. So it's taking a little bit of that guesswork out of it. Now you'll see here too, there is a section for nurse-only income items. And I guess this is being deliberately a little bit provocative to say these are things that you might want to be thinking of doing. There is no Medicare rebate for a wound clinic or the sort, but you may decide that you still want to provide that service and charge a fee for it. And you will need to determine what that fee is going to be. What you'll see here too is that with these nurse-only items, it's going to exclude those items from any calculation of what the GP is going to earn as a consequence of the work undertaken in these types of services. So again, you can just have that level of innovation around it. So for this example, I haven't included anything in there, but you need to simply play with that. So when we add up the amount of time taken for our dummy service here, the recommendation is that the nurse time is going to be approximately 4.3 hours. When we've remediated that to better reflect what we're going to be doing within our own practice, it's come down to 4 hours. So this is going to give you a good sense of how long are these services going to take to actually deliver, and what income is going to be associated with that. And again, that's going to be important when we start looking at calculating the expenses associated with this. So then you'll see here there is a section for QI-PIP, and this allows a practice to incorporate some of the additional funding that a practice might receive through other mechanisms like the QI-PIP or other grant programs or the like into our calculation of the revenue. And you'll see here, there is a little calculator that stems from there. Again, you might want to work with your practice manager to get some of the information with regard to your QI-PIP and what payments you're going to get out of that, so that you can incorporate that in. Our dummy practice has a SWIPE, so standardized whole patient equivalent count of 3,100. We estimate that the QI-PIP component of that for the year is going to be just over 15,000. This practice doesn't have any rural loading, and so then again through calculation it shows you how much that QI-PIP income is on a weekly basis. And that's not to say that all of that should be factored into this service delivery. That's pretty unfeasible and pretty unrealistic. However, for this dummy example, you might allocate, say, $65 out of that $300. So if you put that in there, it's going to add that in there. Sarah,
Riwka, could you just go through really quickly again the difference between columns F and G? There seems to be a little bit of confusion.
Oh, okay. Well, with column F, I think what you're indicating is what's the difference between column F and G and H and I, because there is similarity there. So you'll see up the top here, column F is the suggested nurse time per item. So this is just giving you a guideline of how long such services usually take for a practice. But columns H and I give you the flexibility to modify that to better reflect what's real for your practice. So the guidelines are there just to make sure that when you do your calculations, you're not too far off the mark. And it just gives you a little bit of a yardstick to say, what's fair and what's reasonable for our service, for our circumstance, for our individuality. So that's the only difference there to compare then in terms of nurse time of the rough recommendations to what your practice estimates those services are going to take. So again, maybe just hold off until I talk you through the expense calculator and it will all become just that little bit clearer. So we've added in a little bit of the QI PIP. We can also add in a little bit of funding from the workforce incentive program as well, if your practice decides to do that, and perhaps any one-off grants that may be available, and perhaps that might include some of the APNA grants that you may be tapping into as you're participating in some of the nurse clinic activities and programs that they're running as well. All right. So I just want to make sure we leave enough time for questions at the end. So I'm going to run through this fairly quickly. Let's have a quick look at the expenses calculator. So you'll see up here, automatically populated are the hours per session for the nurse for the suggested time versus your own time. And that allows you to transcribe that information into the calculation of what are the expenses associated with the service. Now, the key expenses for any services of this nature are going to be the fees that the GP is going to be eligible to collect, because, of course, items are being probably delivered under their provider number, so they of course are entitled to some of that revenue. And also, of course, the nursing time, that's also going to be a key expense item. So what this section will require you to do, again, collaborate with your practice manager to get the detail of this. As nurses, you may not be aware of exactly what these amounts are going to be, so you've got to get your team on board to be able to get accuracy around this so that you have good confidence around this budget modelling. So this particular example, the GP is paid 60% of the revenue generated, and so then that calculates it out to, for example, $673 per session. If you play around with those percentages, you will see that if we drop that back down to 50%, then it adjusts how much the GP is going to earn out of that. So again, flexibility around your modelling. In this example, we've said, well, for this particular clinic, the direct service delivery is going to take 4 hours. So we're going to allocate 4.5 hours. There probably needs to be a little bit of planning and admin time in there for the nurse as well. And we've said that the hourly cost for the nurse is $47 per hour. Now, the important thing to remember here, and I'm very well aware that most nurses are not earning $47 an hour in general practice, although they would be worth every cent of that if they did. The key requirement here is that all of the on-costs are included in that hourly rate. So that includes leave entitlements, superannuation, and all of those kinds of on-costs. So it's a marked up amount to encapsulate all of the cost of employing a nurse. Similarly, there could be administrative costs associated with the clinic. Nominally, we've allocated 2 hours here at a rate of $30 per hour. Same thing goes for admin costs, needs to be marked up to incorporate all of those on costs. Then you can see there's a little field here for any consumables that you may need for running your service and anything else that you want to include as a cost base for the service as well. So it will then come up with your recurring expenses. If you are just starting a session 2, you can see down the bottom here, there are some areas where you can put in one-off costs. So they're not going to be recurring, but it might be establishment costs for your service. So if you're just starting out, you might have some marketing costs, or you might need to buy some equipment. You may need to undertake some staff training and the like, developing some resources. So when that's all said and done, and you've got your expenses and your costs all allocated, you then need to indicate how many sessions are you planning to run that model this type of service. And so you can modify that. And in our example here, we've said, well, if we develop this and run it over 10 sessions, then the practice is going to have a profitability of just under $3,000 for that. So that's great, because it shows you that under these constructs, the model certainly is viable, and on an ongoing basis, it would have legs. So again, play with those numbers to just have a look at what your sessions are going to look like. So that's probably all I want to say about the budget planner. It is an important tool, but again, just have a look on the APNA website. There's a lot more information about it there. There is a full explainer as well that will walk you through it step by step on how to fill out each component of this, and again, work with that with your team. Moving on, now we are at the point of having established that from a budgeting point of view, everything's looking okay. We've got a good plan. The bosses have said, yes, let's go ahead with this. We're now looking at the marketing component. So you need to consider, do you need to update your website? Do you need to get some sort of social media presence going? Do you need to have some brochures in your waiting room ready to go for your patients to understand what your new service is all about? Do your doctors need some brochures in their consulting rooms to hand out to patients? Does it need to be posters in your waiting room? There are so many ways that you can go around marketing this service. Do you want to use SMS messaging? That's becoming a very common way of letting patients know about your service, or emailing out to patients who have the eligibility criteria for the service that you're developing. So again, an important component of actually starting to get traction into your system. Now, in terms of marketing too, I would really encourage you, when you're first rolling out your service, is to start small. Remember that PDSA, the Plan, Do, Study, Act methodology, is you don't start off with 200 patients booked into your service. You want to start small so that you can iron out all of the creases first before you start growing it and getting it more elaborate down the track. So again, just remember this, it's an important component of the success for your practice. Education, training and resources, we've kind of talked about that a little bit as well in the planning component. So just ensure that you identify any skills gaps within your team that need to be addressed before you roll out your service. There are heaps of resources available. Of course, APNA is key there, but also your PHNs have lots of resources available for you, and the RACGP. Refer to the RACGP standards for general practices. That's also important to just maintain that congruency with what the standards require of you. And just a reminder that all of this kind of service development absolutely fits into that space of quality improvement activities. So that should be documented within the practice. It doesn't need to be elaborate, but a quick PDSA type of register or an action plan type of register to capture these quality improvement activities. It's great for your patients. You're developing your services. It meets the need of your QI PIP, and it also meets your accreditation standards. So you've got your triple whammy there, and it's great all around. And obviously your patients are going to see the benefits of improved service delivery there as well. Then implementing your clinic, remember you need to consider your appointment schedules. There will be some complexity around managing that and making sure that's effective. Staff rostering to ensure that's congruent. Then attending the patients, how you're going to seek feedback to this service, and payment, especially of course if there's going to be private fees associated. How are those processes going to run? Who's going to collect the fees? What are the fee structures? Is your practice management system set up for the new fees that you may be introducing? All those kinds of considerations. And of course, patient resources and any stock or equipment or consumables that you will need to actually run your service as well. Then you've started running your services, and you need to, like I said before, you need to tap into that evaluation. So you've got to review how things are going. Of course, going back to your data source where you first started is a great way to go. So your PenCat, polar extracts, or directly from your practice management system might start to give you some markers that quality improvement is actually happening. You may be recording more HbA1cs if you're doing your diabetes clinic. You may be better at recording your blood pressures, for example. So you need to have defined your markers of success and what's going to tell you that your services are actually making a difference. And of course, evaluation is also about seeking feedback from your patients. When you get that feedback, it's really key that you share that with your team as well. So take it back to your team through your team meetings or through messaging. Again, however that works for your practice is absolutely fine. And you remember that methodology around plan, do, study, act. It's always that continuous cycle of improvement and reflection and implementation and refining. It's what you do all day, every day. Okay, I'm aware we are getting really, really close to time. We've got a couple of minutes left for some questions. So, Sarah, hit me with your best ones.
Wow, Riwka, we've had quite a few actually around really specific MBS items, but like you were saying, because there's lots of really specific requirements with them, I think it's best to direct everybody to MBS Online. Would you agree with that?
Yeah, I would. And look, I guess it may not be the right time to mention this, but I think perhaps another session focused solely on MBS items and the requirements around that could be a really great idea. It would be a great adjunct to the information contained in today's session.
Brilliant, thank you. We've had a question. How does a nurse delivered clinic get accredited if they're not involving a GP?
I'm not entirely sure what the question is actually asking. Again, I guess it really depends on the kind of service that you're planning on running. So if we're talking about credentialing, for example, for undertaking some of the assessments to inform a GP management plan, there isn't a specific requirement, but obviously the nurse needs to feel that they are actually capable of doing the assessments. Now, I will say if a nurse is involved with the assessment component, that's not so terribly difficult. I mean, this is what nurses are trained to do as part of their nursing training. So the assessment component and the documentation of that is really not terribly difficult and wouldn't require specific training. I know certainly APNA has many resources available to help frame what that is all about and how you can do that most effectively. But if you're considering other types of services, then credentialing may well be required. So for example, for cervical screening services, that absolutely requires a nurse to be credentialed to provide that service. It is an interventionist type of service, and that can't be undertaken without appropriate credentialing. So again, you need to know, well, what's the service you're running? and what's the credentialing requirements going to be for that service? For some, there will be. For others, there won't be. It could be in-house. It could be external. It could be formal. It could be informal. And that's again probably a really broad answer, but that's the complexity of developing your model of care and your particular service.
Thanks, Riwka. I think we've just run out of time. But thank you very much. I just want to say thank you, everyone, to all of your questions. Thanks for attending today, and we hope you've learned a lot about how to establish your own nurse clinic today. Big thank you to Riwka for delivering this webinar. And I just want to very briefly let you know about how APNA can provide support to members and non-members as well. We have a nurse support line. If you just want to jump to the previous slide, Riwka, maybe, just to have that content shown. We do have a nurse support line, which APNA members can access with unlimited inquiries to a registered nurse, and that's via the email or telephone number you can see. And also non-members can receive one complimentary interaction. Obviously, when we're talking to you, we would encourage you to become a member, where you'd be able to access that unlimited support. We also have an APNA members Facebook group, which can be of great support to primary care nurses. You can ask questions here and share advice with nurses across Australia, and also engage in that peer support. So it's a great way to network. This is an especially useful resource, I think, during these COVID times when we're working more in that, engaging more in that digital space. And we also have a number of different programs and projects, which you can see on your screen there. The Transition to Practice program. It's a 12-month support program for newly qualified nurses who are starting their career in primary care, or experienced nurses who have transitioned into a primary care setting. So in this program, we match nurses with experienced nurse mentors who provide support and guidance. We then have the Building Nurse Capacity Project, which I run, and this project supports nurses with to establish their own nurse clinics, like we've been talking about today. So we're using a nurse-delivered, team-based approach. Applications for the next group for this project do close at midnight on Friday, the 11th of September. So if you're keen, get cracking. There's lots of information on our website, and the application details are there too. And finally, APNA offers lots of evidence-based best practice information and lots of educational resources. So you can access a whole suite of online learning resources with over 200 hours, and that's available to both members and non-members. So if you'd like some further information, our contact details are on the next slide. And thanks again for participating today, and we hope to see you at our next webinar. Have a great afternoon.
And I also just want to encourage everyone, if you've got some individual questions, please feel free to reach out. I'll be very happy to answer your questions as well.
Brilliant. Thank you.